If you leave like a rubber band sitting on a hot dashboard for a few weeks and then you try to stretch it, it just snaps.
Yeah, it completely shatters.
Right, completely loses its elasticity, it loses its compliance.
Because the structural integrity is just compromised at a molecular level, the material actually becomes brittle.
Exactly. And usually, when human tissue gets like that, when it becomes rigid, scarred, and brittle, we are told the damage is basically done.
Yeah.
The historical consensus in medicine has really been that we can stop the damage from spreading, sure, but we can't take that dry, cracked rubber band and make it stretchy and resilient again. It's always treated as a permanent end state.
Right, which is exactly why the stack of sources we are looking at today represents such a massive, a truly massive paradigm shift.
It really is.
We have dermatology guidelines, some incredibly dense molecular biology research papers, and fresh clinical trial data that all point to a very different reality. We are looking at evidence that tissue scarring or fibrosis might actually be reversible.
Which is just mind-blowing. So our mission for you today in this deep dive is to explore exactly how a specific intervention, polynucleotide injections, alters sub-mucosal fibrotic tissue compliance in a condition called advanced vulvar lichen sclerosis, or VLS.
Yeah, and I know it is a highly specific condition, but the biological implications here are just staggering.
Right.
Because for a very long time, medicine has only been able to manage VLS. We mitigate the symptoms, but these sources outline a genuine shift from disease management to actual tissue regeneration.
Which is the holy grail.
Exactly. We are talking about using highly purified DNA fragments to physically rebuild the tissue, reverse severe scarring, and restore mechanical function to the skin.
Okay, let's unpack this, because before we can understand how DNA fragments reverse severe scarring, we need to understand the battlefield, right? What is actually happening in the tissue of someone with VLS?
Well, we have to look at the cellular level.
Right. And for those unfamiliar, this is a chronic, highly distressing inflammatory condition. It takes flexible, healthy vulvar tissue and turns it into rigid, painful, easily torn scar tissue. Basically, the tissue loses all its compliance.
Yeah, and to understand why the tissue loses its mechanical ability to stretch, we have to look beneath the surface. VLS is fundamentally an immune dysregulation.
The body attacking itself.
Exactly. The body's own immune system misidentifies local, healthy tissue as a threat and launches a coordinated attack. And the research specifically points to an overactivity of Th1 cells.
Okay, let's break that down for a second. Th1 cells, they're essentially the immune system's frontline infantry, right?
Yeah, that's a good way to look at it.
Normally, they're the ones deployed to fight off foreign invaders like viruses or certain bacteria.
Right, that's their intended job. They coordinate the early, really aggressive phase of an immune response. But in VLS, they're inappropriately activated. They're just swarming the local vulvar tissue.
It's just a massive overreaction.
Huge. And this swarm seems to be heavily influenced by the upregulation of something called microRNA 155.
MicroRNA 155. Okay, let's make sure we're clear on what that actually is. Because a microRNA isn't a cell itself, is it? It sounds like a piece of genetic code.
No, it's not a cell. It is a tiny, non-coding RNA molecule. You can kind of think of it as a microscopic volume dial for the immune system.
A volume dial.
Yeah, it doesn't build anything itself, but it binds to messenger RNA and regulates how certain genes are expressed. In a healthy state, microRNA 155 helps ramp up the immune system to fight a temporary infection, and then, crucially, it ramps it back down.
Right, so things go back to normal.
Exactly. But in VLS, that volume dial is just jammed at the highest possible setting. It locks the entire local immune system into a state of chronic, hyperaggressive inflammation.
So we have the immune infantry swarming the area, and their chemical volume dial is just jammed on max. What are they actually attacking, though? I mean, they aren't just firing blindly into the tissue, are they?
No, it's highly targeted. The specific target of this autoimmune attack appears to be extracellular matrix protein 1, or ECM1.
ECM1.
Yeah, the body produces autoantibodies, which are basically these targeted homing beacons that lock onto the patient's own ECM1 proteins. Once those beacons are attached, the immune cells move in and neutralize the protein.
Wow. So if we imagine the healthy skin and the submucosal layer as a high-rise building, ECM1 is essentially the flexible steel scaffolding that holds the whole structure together.
I love that analogy, yes.
Right, it keeps the building resilient, it allows it to sway in the wind without snapping, and it supports the plumbing like the blood vessels. So if the immune system is essentially rusting out this scaffolding, is that why the building collapses into a dense, inflexible heap, what we call fibrosis?
That is exactly what happens. The destruction of ECM1 is the catalyst for the entire fibrotic process, because ECM1 is critical for maintaining the dermis and promoting healthy blood vessel formation.
So without it, everything just falls apart.
Right. When those autoantibodies target it, the scaffolding literally degrades. The tissue goes into a state of severe oxidative stress, and the normal, beautifully organized architecture of the skin just collapses.
And the body doesn't just ignore a collapsing building, right? It tries to fix it.
It panics. It absolutely panics. The local fibroblasts, which are the cells responsible for building and maintaining the extracellular matrix, they detect the structural failure and try to repair the damage.
But I'm guessing it doesn't go well.
Not at all, because the microenvironment is incredibly hostile. It is flooded with inflammatory cytokines from those Th1 cells, and it's starved of oxygen because the local blood vessels are failing.
So it's basically a chaotic repair job in a hostile environment.
Exactly. The fibroblasts just don't have the resources or the proper signaling to rebuild the flexible scaffolding, so instead they just churn out dense, highly cross-linked, completely disorganized collagen fibers.
And that's the scar tissue.
Yes. This is what forms the stiff submucosal fibrotic tissue. And over time, this disorganized scarring can even lead to severe architectural distortion, like the fusion of the labia, or what is known clinically as a buried clitoris.
It sounds so painful, but okay, if we know exactly what is destroying the scaffolding, this overactive immune response driven by Th1 cells,
Yeah.
why can't we just shut the immune response off?
Well, we do try.
Right, which leads us to the standard treatment. Because according to the dermatology guidelines we have here, the gold standard therapy is ultra-potent topical steroids, specifically a medication called clobetasol propionate at 0.05%.
Yeah, ketotinosol propionate is a very powerful immunosuppressant. If the hyperactive immune system is a raging fire burning down the cellular scaffolding, the potent steroid is like a chemical fire hose.
Okay, a fire hose.
It penetrates the tissue, suppresses the activity of those Th1 cells, forcibly turns down the inflammatory signals, and stops the act of destruction.
But stopping the fire doesn't rebuild the house.
Exactly.
I mean, the damage to scaffolding is already done.
And this is the massive limitation of the gold standard defense. Steroids are excellent at disease suppression, sure, but they offer zero regenerative capabilities.
They just put out the fire.
Right. They do not rebuild the extracellular matrix, they cannot replace the lost elasticity, and they possess absolutely no ability to alter or soften the stiff, fibrotic tissue that has already formed.
Plus, steroids have their own side effects, right?
Oh, definitely. The prolonged use of potent steroids carries its own risks, like contributing to further tissue thinning or atrophy over time.
So what does this all mean for the patient whose tissue is already scarred? Because from the clinical trial data we are reviewing, even when a patient's inflammation is technically considered, like, under control by their doctor, they are often still living in a state of quiet misery.
It's awful. And it comes back to the loss of tissue compliance. The tissue physically cannot yield. It cannot stretch.
Even without the acts of inflammation.
Exactly. Even without the fire, these patients experience severe daily dryness and relentless itching simply because the mechanical function of the tissue is broken.
The structural integrity is just gone.
Yeah. And the most devastating symptom for many is dyspareunia, severe pain, or physical tearing of the tissue during intercourse. Because the skin is basically trapped in the state of that brittle rubber band on the dashboard.
It just snaps. So if steroids are just the firefighters, we need an intervention that actually acts as the construction crew. We have to move out of the realm of disease suppression and into regenerative medicine.
Which is the really exciting part.
Yes. Which brings us to the core of the molecular biology papers we have today, polynucleotides.
What's fascinating here is that polynucleotides, or PN, and their closely related cousins, polydeoxyribonucleotides, PDRN, they are essentially highly purified DNA polymers.
Okay.
And the primary source for these medical-grade DNA fragments is just wild. They're extracted and purified from the gonads of male salmon trout.
I have to admit, when I first read salmon trout sperm DNA in the research, it sounded a bit like science fiction.
It totally does.
I mean, why salmon? Why on earth are we injecting fish DNA into human tissue to fix scarring?
It really comes down to biological compatibility and purity. Salmon DNA is incredibly similar to human DNA in its basic base pair
Oh,
structure.
really?
Yeah, but the extraction process from salmon milk allows for the harvesting of a massive, highly concentrated volume of DNA, and the purification process is rigorous. It completely strips away any proteins, peptides, or other complex molecules that might trigger an immune or allergic reaction in a human.
So it's totally safe.
Right. What you are left with is just the raw, fundamental building blocks of DNA.
If steroids are the fire extinguishers, polynucleotides are the master architects arriving at the burnt-down site, handing the surviving cells a brand new set of blueprints and premium building materials.
That is spot on.
So we take these purified salmon DNA fragments, these raw building blocks, and we inject them directly into the rigid, scarred, sub-mucosal tissue of the vulva.
Yes.
Here's where it gets really interesting. The biological mechanism of what happens next is what shifts this from just providing materials to actively commanding regeneration. How do these salmon DNA fragments actually communicate with the rigid scarred tissue to make it soft again?
It's all about the receptors. When the polynucleotide gel enters the submucosal layer, the DNA polymers physically bind to specific receptors on the surface of the patient's fibroblasts.
As we mentioned, fibroblasts are the cellular factories that secrete collagen and build the extracellular matrix.
Exactly. And the specific receptor that these DNA polymers target is called the adenosine A2A receptor.
Okay, so the DNA fragment acts like a biological key, and the A2A receptor on the outside of the fibroblast is the lock.
Yes, perfectly said.
When that key turns in the lock, what happens inside the factory?
The binding activates a highly specific intracellular cascade known as the CAMP-PKAC-REBS signaling pathway.
Okay, wait, before we get lost in the alphabet soup of molecular biology, what actually is a signaling pathway? Because we throw that term around a lot in these deep dives. Is it like a cellular telephone wire?
That is a very helpful way to visualize it. A signaling pathway is essentially a molecular bucket brigade.
A bucket brigade, I like that.
When the receptor on the outside of the cell is triggered, it activates a molecule inside the cell, in this case, cyclic AMP or CAMP.
Right.
That molecule activates the next protein in the chain, pKa, which activates the next, CRE. This message gets passed down the chain until it reaches the nucleus of the cell, where it actually changes which genes are being turned on or off. It is a command relay.
Hold on, let me play devil's advocate here. You're saying this specific bucket brigade, the signaling pathway, stimulates the fibroblast to produce collagen to repair the tissue.
Yes.
But earlier, we established that the scar itself, the fibrosis, is essentially an overproduction of dense collagen scar tissue.
Right.
So why would we want to stimulate these cells to make more collagen when collagen is the problem? Aren't we just adding more concrete to the block?
Oh, this is the absolute crux of why polynucleotide therapy works. I love this part. Not all collagen is created equal. During the active disease phase, when the tissue is inflamed and starved of oxygen, the fibroblasts are operating under the influence of inflammatory pathways. Specifically, molecules like TGF-beta and NF-κB.
Now, what did TGF-beta and NF-κB do to the cellular factory?
They are essentially panic signals. When fibroblasts are driven by TGF-beta and NF-κB, they rapidly turn out a type of collagen that is thick, highly cross-linked, and totally disorganized.
Like a messy repair job.
Exactly. Imagine dumping wet, heavy cement randomly into a pile. That is fibrotic collagen. It has no structural logic, and therefore it has absolutely no stretch.
The concrete block.
Right. But, and here's the magic, when the polynucleotides bind to the A2A receptor and activate the CAMP-PKA-CR pathway, they override those panic signals.
Oh, wow.
They shift the fibroblasts completely away from that destructive fibrotic pattern. The factory resets. Instead of chaotic wet cement, the fibroblasts are reprogrammed to meticulously weave beautifully organized type I and type 3 collagen.
So the new command coming down the bucket brigade is to stop pouring concrete and start weaving a highly organized, flexible basket.
Exactly. Furthermore, the pathway doesn't just stop at organized collagen, it also stimulates the fibroblasts to produce fresh elastin fibers, which provide actual snapback to the tissue and glycosaminoglycans.
Glycosaminoglycans, say that 3 times fast. Are those the molecules that hold onto water?
Yes. They are essentially the microscopic sponges within the extracellular matrix that keep the tissue hydrated and plump.
Which the tissue desperately needs.
Exactly. And this specific targeted reorganization of the extracellular matrix is what actively restores the tissue's compliance. It replaces the chaotic scar tissue with organized type I and 3 collagen, new elastin, and deep hydration.
So the tissue regains its mechanical memory. It can actually yield to pressure, stretch, and absorb force safely again.
Precisely.
Rebuilding the cellular scaffolding and giving the tissue back its flexibility is incredible. But, you can build a beautiful new house, and if it's sitting in a toxic wasteland with no water lines, it isn't going to survive very long.
No, it won't.
The cells need a healthy surrounding microenvironment to function long-term.
Do these DNA fragments do anything about the hostile environment left behind by the disease?
If we connect this to the bigger picture, the polynucleotides are profoundly altering the entire tissue microenvironment at the same exact time they are directing the rebuilding of the scaffolding.
So they do both.
Yes. First, these DNA fragments act as potent free radical scavengers.
We mentioned oxidative stress earlier when the scaffolding was collapsing.
Yeah.
Free radicals are the underlying mechanism of that stress, right? They are like unstable molecules missing an electron, so they act like microscopic chainsaws tearing through healthy cells to steal an electron and stabilize themselves. How on earth does a DNA fragment stop a chainsaw? It's all about their physical shape. The polynucleotide polymers have these complex molecular ring structures. Because of their shape and chemical composition, they can physically absorb the impact of these destructive oxygen molecules.
Wow. So they just soak it up?
Yeah, they act as a molecular decoy or a sponge, neutralizing the free radicals before they can damage the fibroblasts or the newly forming collagen. They provide this intense, localized antioxidant shield.
That is amazing. So they're clearing the toxic wasteland. But what about the plumbing? We established that the fibrotic scarring choked off the local blood supply, starving the tissue.
This is arguably their most vital secondary function, angiogenesis. The activation of the A2A receptor by the polynucleotides strongly promotes the formation of new capillary networks.
Wait, it grows new blood vessels?
Yes, the body's prompted to physically grow new blood vessels into the scarred area.
Restoring the microcirculation, bringing vital oxygen and nutrients back into the tissue so the fibroblasts have the energy they actually need to keep weaving that flexible basket.
Exactly. It creates a self-sustaining loop of regeneration.
So if we look at this from the perspective of the patient, the clinical trial data shows exactly how this molecular activity translates into real life. You have a massive increase in healthy blood flow through angiogenesis. You combine that with the fact that these polynucleotides are highly hydrophilic, meaning their structure naturally binds to and holds water in the tissue.
Right.
So you have new blood flow, you have highly organized, flexible collagen, new elastin, and profound deep tissue hydration.
Right.
Clinically, this directly translates to the reversal of vulvar atrophy.
The chronic dryness just vanishes. The mechanical function returns.
The tissue can stretch again, the severe daily pain and the dyspareunia just melt away. The patient's quality of life and sexual function are actively restored, not just managed.
It really is a marvel. We are looking at a cascade of events that moves from superficial symptomatic suppression right down to the fundamental molecular reprogramming of tissue mechanics.
It's a total game changer.
It reinforces a critical concept in modern medicine. Understanding the exact biological mechanism, the why and the how behind a pathology, empowers us to change the narrative. Critical thinking really does empower patients.
It does. I mean, for decades, we just accepted that the rigid scarring of VLS was a permanent endpoint. We just handed the patient a fire extinguisher and told them to manage the heat.
Right.
But knowing that we can leverage purified salmon DNA to activate specific signaling pathways and actually teach fibrotic tissue how to behave like healthy elastic tissue again, it shatters how we view chronic scarring diseases. It means tissue fate is not always a one-way street.
It proves the body's machinery is still there, just waiting for the right localized instructions to begin repair.
Which leads me to a final thought for you to chew on after we wrap up today. We've spent this entire deep dive looking at how this specific intervention alters sub-mucosal fibrotic tissue compliance in the vulva. But fibrosis, that chaotic, panic-driven pouring of cellular concrete, is a universal biological response to severe damage.
It happens everywhere in the body.
Right. So if we can use these DNA fragments to teach rigidly scarred tissue in the vulva how to weave flexible collagen again, could this exact same CAMP-PKC-Cook rib signaling pathway eventually be targeted to reverse fatal scarring in major internal organs?
Oh, that is the million-dollar question.
Could we one day use localized polynucleotide interventions to restore compliance to a stiff, failing heart after a massive heart attack? Or to lungs that have been turned to rigid scar tissue by severe respiratory disease? The next time you find an old, brittle rubber band, just remember the blueprint to make it snap back might already be swimming upstream.
It's an incredible thought.
Thanks so much for joining us on this deep dive. We'll catch you next time.